Hi, so let's start with polycythemia, abnormal increase in absolute RBC mass and hemoglobin. It is relative or absolute. In relative, plasma volume gets decreased. In liquid loss or in case of diarrhea or increased vomiting, the volume of the body or serum level will get decreased. So, relative to that, RBC mass and hemoglobin will appear to be increased. Okay, and in case of absolute, mainly due to congenital reasons, polycythemia like polycythemia vera, unknown etiology, myeloproliferative neoplasm of hemopoietic stem cells can occur. Abnormal increase in RBC mass is seen. Increase in RBCs is independent of a EPD, erythropoietin level. Increase in RBC is independent of erythropoietin level. Clinical features are gingiva and other sites appear purplish red, ecchymosis and hematomas and cyanosis are also seen but rarely. Okay, this is polycythemia. Relative or absolute increase, abnormal increase in the RBC mass or hemoglobin. Okay, sorry, absolute. Now let's moving forward. WBC disorders, leukopenia. Decrease in WBC count. Normal count is 4 to 11K per mm cube, and in leukopenia, less than 4K. Impaired defense mechanism. Oral manifestation increase infections like herpes, recurrent after stomatitis, candidiasis, increased incidence of periodontitis, and delayed wound healing. Now, cyclic neutropenia. Special type of leukocytopenia. It is a period of 21 days, 4 to 6 days. Decrease, it occurs in a period of 21 days and 4 to 6 days. Decrease neutrophils, revert back to normal. Then this period like increase of in then normal, and then revert back to normal, and then this period decrease neutrophil period. Okay, like this it occurs. Okay, up till 21 days. Okay, like three times between 21 days, decrease and then normal, and then decrease and then normal, and then decrease and then normal. Okay, now oral manifestations are seen like recurrent after stomatitis, gingival ulcers, recurrent attacks like children in children. First we see gingival ulcers surrounded by edematous on biopsy, edematous necrosis, surrounded by edematous necrosis on biopsy, devoid of histopathology, devoid of neutrophils. It will be devoid of neutrophils. Okay, gingival ulcers, if on biopsy we take devoid of neutrophils, surrounded by edematous necrosis. Recurrent attacks, if occur in children, permanent bone loss may occur, leading to early exfoliation of teeth. Cyclic neutropenia is one of the cause of early exfoliation of teeth in children. Okay, because in recurrent attacks or cyclic neutropenia, it may cause permanent bone loss. Okay, now leukemia. Okay, first we have studied leukopenia, decreased WBC count, then cyclic neutropenia, decreased neutrophils for 21 days, and then leukemia, increased WBCs, and seen in immature blast form. Blast means we have studied in megaloblastic anemia. Immature. Blast means immature. Okay, blast means immature and mega means large. Okay, so leukemia is WBCs as increase and seen in immature form. Neoplasm of hemopoietic cells. These are of two types, myeloid and lymphoid. Neoplasm of hemopoietic cells. Hemopoietic cells are of two types, myeloid and lymphoid. Okay. Now, myeloid have acute and chronic, and lymphoid have acute and chronic. Secondary compression of bone marrow. Secondary compression of bone marrow occurs. So, acute myeloid leukemia, chronic myeloid leukemia, acute lymphoid leukemia, chronic lymphoid leukemia. Okay, RBCs and platelets are suppressed. RBCs and platelets in this case are suppressed in leukemia due to abnormal excessive proliferation of immature WBCs. Okay, General oral manifestations are gingival hyperplasia, most common in acute myeloid leukemia. Gingival hyperplasia occurs in acute myeloid, most commonly in acute myeloid leukemia of a monocytic differentiation. Okay. Then aphthous like ulcer, herpetic ulcer, candidiasis, and decreased WBC or decreased platelets, anemia like picture, pale, and 3Gs, glossitis, glossopyrosis, and glossodynia. And then in case of platelets, gingival hemorrhage, petechiae, and hematoma rarely seen. So, in short, leukemia is increased WBC, okay, and neoplasm, because neoplasm has occurred in hemopoietic cells, and it will increase the WBC, and so oral manifestations are based on decreased RBC and platelet, because increased WBC will suppress the platelet and RBC, so it will cause decrease RBC and platelet symptoms. Okay. The third is a disease involving platelets. Okay, thrombocytopenia. Decrease platelets by assessing bleeding time. Okay, platelets decreased by assessing bleeding time. We count platelets decrease. Normal platelets are 1.5 to 4 lakh per mm cube. Due to decreased platelets, bleeding time will be increased. Decreased platelets, bleeding time will be increased because platelets has a job to clot, to form a clot formation, but it is decreased, so bleeding time will, clot will not form and bleeding time will be increased. Okay. Purplish discoloration of skin and mucosa due to bleeding, or due to spontaneous extravasation of blood. Purpura symptom. Quantitative disorder, number gets decreased. Quantitative, in number it gets decreased. Thrombocytopenia, purpura, platelets number gets decreased, or platelet number, platelets are normal but purpura is seen. Qualitative, platelets are normal but purpura is seen, it is called as qualitative disorder. Normal thrombocytopenia, normal thrombocytopenia, it is thrombocytopenia due to decreased platelet number, but it is not due to decreased platelet number. Platelets are normal but other factors cause breakdown of capillary walls. Okay, so it will cause purpura. Oral manifestations, both have non-thrombocytopenic and thrombocytopenic purpura, both have same oral manifestations. Petechiae, small purpura, ecchymosis, large purpura, gingival hemorrhages, and hematoma. Okay. Now, diseases of specific blood factors, clotting factors deficient, non-functional, clotting time is increased. Okay. Clotting time is increased means bleeding time is normal, but bleeding time is normal. Bleed normally हो रहा है, but clot देर से form कर रहा है, so it clotting time will be increased. Clot will be formed late, so the time for clot formation will be increased. Okay, so clotting time will be increased, but bleeding time is normal because not associated with the platelets, because it is not associated with platelets blood, but blood factors associated with blood factors. Prolonged internal bleeding post surgery or post injury. Prolonged internal bleeding occurs post surgery, after surgery, or after injury. First is hemophilias. There are three types of main hemophilias: A, B, C, and three. A, B, and C. Okay, A is decrease in factor 8. B is decrease in factor 9, which is also called as Christmas factor. It is very famous. And C is decrease in factor 11. It is an X-linked recessive trait. Males affected, females are carrier. Also called as Queen's disease or royal disease. Okay. Clinical features: petechia are absent. Petechiae are absent. Okay. In this case, petechia are absent because it is not a bleeding time Uh, abnormality, but clotting time is increased. So petechiae are absent. Increase episodes of bleeding. Increase episodes of bleeding because clotting time is increased. A tooth eruption or extraction. When bleeding time is increased, a tooth eruption or extraction. Contraindication is tranexamic acid or so it is contraindicated in extraction is contraindicated. Tooth extraction is contraindicated here. Tranexamic acid and epsilon aminolepronic acid. Epsilon aminolepronic acid is used as substitutes are used in these patients. Okay, tranexamic acid and epsilon aminolepronic acid. Okay, von Willebrand's disease. Pseudohemophilia, vascular hemophilia, or vascular purpura are the other names of this. Pseudohemophilia, vascular hemophilia, or vascular purpura. Von Willebrand's factor play a dual role: platelet cohesion, plug, and second is activation of clotting factor 8. Okay, so it has two roles. Most common inherited form of bleeding disorder. It is most common inherited form of bleeding disorder. Autosomal dominant trait. Okay. 99% patients are unaware of their diseases. Rare finding are excessive bleeding seen. Excessive bleeding seen after toothbrushing rarely. Post extraction most commonly. Mostly here are diagnosed. At tooth extraction, von Willebrand disease are mostly diagnosed. Plasminogen deficiency. Decreased plasminogen precursor of plasmin clot disintegrate. If plasminogen get decreased, which is a precursor of plasmin, clot get disintegrate and organization of granulation tissue can occur. So plasminogen gene, PLG gene gets mutated, it will cause etiology is PLG gene gets mutated, so it will cause decrease in plasminogen. So plasminogen congenital deficiency, because it is a gene problem. So wound healing will not be completed. Wound healing will not be completed, but because clot will get disintegrated. Pseudomembrane are seen mainly in region of conjunctivas. Okay, pseudomembrane is seen mainly in regions of conjunctivas. First, lignous pseudomembrane, lignous in the eye region, which leads to blindness. Okay, so pseudomembrane are seen. Wound healing is not completed, so pseudomembrane is seen mainly in region of eye, conjunctivas. Lignous pseudomembrane, also called as lignous pseudomembranes, which leads to blindness. And second, also seen in oral cavity, mainly gingiva and tongue, nodular ulceration or hyperplasia. This is plasminogen deficiency. Congenital PLG genes get mutated, so and plasminogen get decreased. Okay, that's it. Thank you. Now our blood hematological disorders are completed. Thank you.